Next up, we have our guest, Kevin Doak. Kevin, please make your way to the stage here. Today's Fireside Chat will be about why Vietnam needs to understand self-care innovation. Innovation's used a lot today. You would hope so, right? Kevin, I first met you, I think in January, February 2022, not even a year.
Correct, yes.
You came all the way from Turkey here to Vietnam.
You were one of the first people I spoke with.
First people.
Outside of my own company. I was 2 weeks into Vietnam when I did the podcast with you.
Yeah. That's when the COVID was raging. Not a lot of outside interactions, but thank you. Thank you for making time to meet me.
Thank you for inviting me again, and thank you for the opportunity to talk a little bit about healthcare. I think, thank you for the first few speeches. There's a lot of commonalities between some of the areas that we're operating in.
Yes. Kevin, your topic's really interesting, and I want to set the stage a little bit, guys, about what is self-care exactly. During the COVID period, especially in the West, you saw, compared to Asia at least, Asia was all about prevention, self-care, wearing a mask, getting a vaccine, or whatever, all these other forms of self-care, whereas the West was all about treatment. You actually get COVID and then you treat it rather than preventing it. And I think those are two very distinctive things to keep in mind. Self-care / prevention versus treatment. And that's what we're going to be talking about today in the context of Vietnam. So Kevin, let's jump straight into it.
Sure.
First off, consumer healthcare. You're the GM of Sanofi for that group. What is that exactly, consumer healthcare in your world?
So for that, a more common term to use is over-the-counter. So it's products that people don't necessarily need a prescription for. In a lot of markets outside of Vietnam, that means it's self-select. You can pick up the product, pay for it, go home. And a lot of it is geared much towards, as you said, making sure that people can promote their health and wellness and prevent things, but also to be able to be educated enough to be able to take self-treatment options so that they can either resolve a health issue either on their own or with minimal consultation with healthcare services and healthcare professionals.
Why does it matter to Sanofi that you guys focus on this?
I think it's
aside from the revenue, that's one thing.
Exactly. It's just not important to Sanofi. I think it's important to everybody in the world, and the pandemic certainly raised more awareness of that. And that's really because it's really about the ability to be able to promote your own wellness, to take care of your own health. And it's something that during the pandemic and post-pandemic, the World Health Organization has been really trying to get people to embrace a lot more and to consider it as more of an all-encompassing perspective, that self-care is not just about medication. It's about good hygiene practices, it's about good nutrition, it's about the environment that you surround yourself in, and it's about a lot of socioeconomic factors as well. So I think it's super important for everybody that they fully understand what benefit that can have. And recently there was a global self-care report by the World Health Organization. And some of the numbers are staggering. You spoke about during the pandemic and the importance of people taking care of their own health in times when there was lockdowns or there was pressure on public healthcare systems. And it's estimated that it's a $119 billion annual savings to healthcare services for countries that really embrace this every single year. And not just financial savings, but for physicians as well, this is critical. It's, I think, 1.8 billion hours of physicians' time that's being saved by people preventing themselves getting sick or treating minor ailments at home, which frees them up to do much more around diseases which need more time and need their intervention, but also so that they can research, do science, they can innovate, and so on, much to the theme of this.
Okay. Yeah.
And over the last 2 years, much like some of the previous speakers, we wanted to find out what that meant for Vietnam as well. With high aspirations as an innovation hub, as driving growth, we commissioned a study with KPMG just to quantify why we should care about this. And it was estimated that if people took preventative steps in self-care, we could unlock $4 billion of extra economic activity that's currently being lost by the workforce, not being in the office, not being able to maximize their economic output. And that would translate also to another $600 million in savings for the government healthcare system. So it's important to Sanofi, it's important to the general public, it's important to the private sector, and it's also important to the public sector.
Kevin, since we spoke, we met up plenty of times after the first podcast, but I myself bought some Pharmaton, so go get some of that.
Thank you very much.
You're welcome. Why should young people care about this? So for you guys to know, most of the older audience here, but I invited some students for those free tickets. They're probably in the back somewhere, a little too shy to sit in front, to come to today to learn more about this as well. And a lot of our listeners are young professionals. Why should they care about this? And how can young people get involved?
I think firstly, they can obviously listen to your podcast, because every single young person who is starting in our organization, when I meet them on their day one, they say, I listened to your podcast. I heard about fast-moving consumer health. I heard what you spoke about there. So I think what we're trying to do is make sure that when we're talking about self-care or when we're talking about health and wellness in general, that we put a lot of thought into not just the now, but we're trying to serve healthier lives for people now, but also for the generations to come. And we broadly identified sort of 4 needs that the younger generation are hungry for, and that we try to gear a lot of our work towards those areas. The first is really in a developing economy, fast changing, it was spoken about, people are seeking for a higher quality of life. Young people in particular, we need to provide them with solutions that can help them to improve their quality of life. And we try to do that through making sure that they have access, making sure these products are available, and as Meta was saying, bringing the best of what we have available globally to Vietnam so that people can take advantage of it here. The second of those is really around science and the science of discovery, and making sure that for the younger generations, we invest into creating new and innovative products and solutions that can benefit their health. And one way we've done that specifically in Vietnam is we're the first multinational pharmaceutical company to build a purpose-built high-tech manufacturing facility in Vietnam. It's one of only 2 of our factories in all of Asia. And we went one beyond that and invested into a research and development center. So we are researching and developing products, healthcare solutions, for people in Vietnam and also around the world. This factory and the research and development is all TGA certified for Australia and to the rest of Asia.
Sanofi is the largest pharma company in Vietnam, is that right? Or one of the largest?
Yes, so they're the largest multinational pharmaceutical company, okay, and also within our sector.
Can we do a factory tour too?
You are more than welcome to come for a factory tour. I'll exchange with Heineken. You are all welcome to
one after the other. Let's go to Vung Tau and then wherever the Sanofi one is, same day. Kevin, actually, I think my mom's in the audience. She just arrived yesterday. I invited her to today's conference. My mom, who's a nurse, shares a lot of the sentiments that you have, and I took her out to where I live. I live in Tu Thiem. You have to cross the bridge, and in Tu Thiem right now, you've got these glamorous apartment buildings, but you have also a lot of like trash out there. Nobody's really taking care of it. But also, the riverbanks are full of, in the evening, kids and young people and families just having everything from coffee to drinks outside on the riverbank. And and my mom was saying how, a lot of these kids are just drinking sugar all day long. And she told me these kids are all going to have cancer when they grow up. They're not taking care of themselves. What more aside from just education can young people do to actually think about self-care? Like, what are some things that you feel like these young kids need to take action now?
I mean, one of the first phrases, it's funny, one of the first phrases I learned in Vietnamese when I moved here was "Kham Dung." No sugar.
Okay.
Because I also feel the same.
Kham Dung, okay.
Kham Dung. My terrible accent is being tested. But I think there's a huge bit about partnership. And I think it was spoken a little bit about both public and private. And the Vietnamese government has very clear priorities in terms of driving better healthcare, particularly for young people. A lot of that in the past has been centered around nutrition and goals in terms of raising the average height and making sure that the nutrition is there for people to be able to maximize and fulfill their potential. But I think a lot of it comes down to the communities. And we're trying to make sure that between public, private, and community, that we drive that connection. And honestly, one of the biggest enablers is education. And it was mentioned earlier about the ratio between urban and rural. And we shouldn't forget that even we see down by the river in Thu Thiem, but that the rural population still has a long way to go in terms of reaching some of this education and awareness. So that's a big one in terms of what we can try to do to help young people. The other one is really in terms of access and making self-care solutions available to people where they are. And I think some of that is being enabled by some of the digital transformation in e-health. And certainly the availability of e-pharmacies and some of the partnerships that Meta was speaking in terms of how you engage one-to-one with consumers and with people whilst they're looking for information. And I know next week you have a lot of exciting speakers at the Healthcare Summit that you're running, including some of the other partners like GeoHealth and things like this that are really driving people to use technology as a way of helping people reach the information they need to improve on their health.
Let's talk about digital transformation. It's been a topic discussed quite a bit today, not just from the tech companies that will or have already spoken, but even from the folks like Heineken. They've had to learn technology. Have you had to learn technology since you started here? And what is Sanofi doing in that sector?
Yeah, I think from a digital transformation point of view, similar to some of the other speakers, it's kind of been driven across the whole value chain. So we do have, of course, our manufacturing facility here is equipped with the same robots that I see outside there in terms of enabling a faster manufacturing process and more efficient. Obviously, because we are manufacturing medicines, we really need to use a lot of digital testing to be able to make sure that the quality and the science is there behind it. And obviously we've gone through changes in the route to market and the way that we deliver our products to consumers and make them available through e-health platforms and so on. But really one of the biggest areas that we've transformed, and it's quite innovative for healthcare, and pharmaceutical companies are traditionally quite conservative in this manner, is that we have really transformed digitally the way that we engage and communicate with consumers directly, with a goal of being able to drive education, drive awareness, and ultimately drive consumption in these categories. And we're super proud recently in terms of some of the recognition that we're starting to get for some of the advanced digital marketing campaigns that we're starting to run. Healthcare still has a long way to catch up with some of the more consumerized categories. But we're on that journey, which we spoke about in the podcast, of creating this fast-moving consumer health company in and for Vietnam. And we're so pleased to see that some of the geo-targeting, real-time marketing is now being recognized as best in class. And it comes with a purpose. We did this during World Allergy Week. We were targeting Grab drivers who were suffering allergy from pollution, and we were offering them a free discount to be able to pick up one of our products, which can help them in a time of need. So it's all linking back to something that we can help people realize there are these solutions, and they don't need to go to the hospital and incur those costs and those hours on that physician time that COVID really highlighted that we need to divert elsewhere.
We've got a last couple of questions here, Kevin. Of course, CHC, consumer healthcare, it's related to over-the-counter, as you mentioned. What's the future, in a short bit, if you could share about OTC in Vietnam? There's pharmacies popping up on every single corner, and e-pharmacies now even. What's that future look like?
I think it's been a really dynamic journey within the OTC market. It's now valued at a $3 billion market in Vietnam.
How big could it go?
Well, we expect that growth to try to continue. And the question is really what laws and regulations are there to further enable the acceleration for people to safely consume OTC medicines. And a lot of that comes down to education. We do expect it to continue in sort of mid to high single digits CAGR over the next 5 years, as it has done historically. And a lot of that is enabled by some of these macro trends that you see. Even though Vietnam is a young average age, it is a rapidly aging population, which means people are going to live longer and they have to look after their health for longer, and self-care and OTC plays a massive part in that. Similar, we have a lot of people entering the consuming class, and they have an openness to want to prevent getting sick rather than actually treating when they do. And that's one of the biggest things that I think, how big could it go, is that we're at a little bit of a tipping point. Historically, before the pandemic, we didn't have a healthcare system. We have a sick care system. It's a system that once you get ill, you go to the hospital and you treat. So it's a sick care system. And what we're transitioning rapidly towards is much more of a healthcare system where people want to stay healthy for longer to prevent having to go there. And how we incentivize that and how we make that available to more people is going to be critical for how big it can be and how dynamic that can be.
Healthier, better lives. We're going to be hearing from Wayne Besant, the CEO of ARIA. He's going to touch upon a lot of the topics that Kevin just mentioned here as well. Kevin, 2 final questions. It sounds like self-care is the future of pharma. Is that true, in your opinion?
That sounds like a quote I can use for the rest of the year. Okay. Self-care is the future of pharma. I mean, I think it has to come hand in hand with the rest of the self-care system. Really what we're trying to do is promote responsibility for people and enable them to take their health in their own hands. And that's how we're trying to bring self-care awareness to everybody. And that has a role for everybody, whether that's Sanofi and pharma companies or whether that's the public sector or the private sector. Enabling people with better access, better education, and better solutions will allow people to take responsibility for their health. And everybody's done it during the pandemic, as you said. The moment you took an at-home COVID test, you were taking a preventative step to spreading the disease and so on. That is self-care. And so we're really at that inflection point where people understand that. And we have a big future to play in working with all of the stakeholders to be able to involve everybody in developing that sector. And it's critical that partnership plays a big role. And I think this kind of forum allows us that opportunity to share with other stakeholders, and particularly young people, in how we can all be involved in that.
Excellent. Kevin, same question that I asked a lot of the folks here. You mentioned earlier a lot of the people that you've been hiring, or even people at Sanofi already, have listened to your show and knew a little bit about you and your love for Fulham FC, which just beat Liverpool. Is that right? Did they
we drew with Liverpool.
Oh, drew. Sorry, you beat somebody else. Okay, so your staff they wanted to listen to learn more about who they're going to be working with. From your perspective, not even been a year in Vietnam, who and what industries would you like us to cover and for our audience to look forward to?
It's actually related to what you said. I think that sometimes we should be very open to learning from adjacent areas or totally different areas about innovation and leadership and how that's driving things forward in industry. Personally, I love sport. So I would love to hear from leaders who are innovative in areas of sport, wellness, and these kind of things. Because as I said, health is not just about OTC medication. It's also about lifestyle and how you can live a healthier lifestyle. And I think there are some really groundbreaking areas in terms of sports science, in terms of leadership, and from a purely selfish point of view, loving sport and exercise and things, I'd love to hear people who are innovating and leading in that space, because I think we can all learn a lot from those kind of things. And when I speak to young people, that's certainly things that they look at. We were talking about influencers and things like that. So if you can get Ronaldo, I think I would listen to that episode.
I'll do my best. Can't be as good as Piers Morgan, but I could do, hopefully, just right below that. Thank you, Kevin, so much. Look forward to that sport podcast. Hopefully it'll come out soon. Thank you so much, Kevin.
Thank you very much.
Care. Yeah.